Hey there, Dr. Jason with Elite Health. Hope you're doing well. Today I want to talk to you about the story, an incredible story of a patient here under our care about hope and why you just can't give up if you're dealing with some really serious health challenges, okay? So this patient came to us, probably close to almost a year ago and had been just unbelievably shaken by her experience with medicine. She actually almost died multiple times in the last several years prior. Just recently, before she started care with us, she had been on a regimen with massive antibiotic treatment for what they found out was Lyme disease. Almost 9 months of like heavy duty antibiotics, and she actually was feeling better during that course. And this was under the treatment of a apparently world-class Lyme doctor. And then she got off that treatment and almost died a third time. And it's just like she just didn't know where to turn, okay? You can imagine you thinking you found like the answer to your problems and you had to let you down again. And she had this happen over and over again. Just to give you a little background, they had built a dream house, just an awesome house and some property. They actually had to put that up for sale just due to her health problems and the financial burden of this. She had been to dozens and dozens of providers, mostly conventional. I think 1 or 2 functional doctors in there as well. So she had been really through let's call it due diligence, right? She just didn't pick one doctor and just expect her to heal from that one experience. She really sought the best that she could find, and it just wasn't working. It just wasn't working at all for her. So she found out about us, came to the program, and we did our exam that we're known for. I looked top to bottom, and that's one thing that practicing holistic medicine, the other providers were not looking at. They weren't looking at our whole entire ecosystem. They were just focused on that pathogen, called Lyme. Now, Lyme can get very serious. We can talk about the ins and outs of Lyme, but you can't just sit there and stare at one pathogen, okay? That's, again, called allopathic or reductionistic thinking. And again, there's many components to why is that pathogen in the body? What organ systems is it affecting? Are there co-infections in there? And you're gonna hear a lot about psychosomatic things, right? There's a lot of mental mindset things involved as well. I mean, huge stuff. In fact, there's literature out there, guys, that shows that you actually can have a successful treatment of a pathogen and your body still acts the same. It feels ill. Isn't that incredible? That's a phenomenon that we're coining called the cell danger response. Chronic illness has created this danger to the body over so many years that it literally starts to downregulate mitochondrial function, which is how you make energy, starving the body of energy. If you don't have energy, remember, it's only going to give you energy for the essential functions of your body. It's going to starve it, and so you're not going to get good detox. You're not going to feel energetic. You're going to probably have a lot of fatigue, okay? And that's going to go on and on. So again, the cell danger response to our body, the body produces over many years of chronic illness, is going to make it so even if you kill the pathogen, like let's say Lyme, okay, you still feel like you got Lyme disease and it could be long gone. And this is actually in published literature. There's many more pieces to this. That's why I was saying about you can't just stare at a pathogen and go all in on just that. There's a lot more to it. So, all right, so here's the deal with this patient. Again, we did an outstanding exam as we always do. We like to get lots and lots of information. Without information, you can't make good decisions, right? You can't make a plan. You can't just, again, look at one test result and say, oh, we think we figured it out. So we have 5 modalities in clinic. She did a great job with the paper trail, bringing all her labs here. I poured through that for several hours. She did get some functional labs prior to coming to our clinic here. Check those out. So she did a great job of, again, getting some alternative information, which, by the way, is essential. You can't just rely on standard blood labs. You got to get outside and get urine values, to get saliva values for other things. Anyway, looking through all that, had a really good idea what was going on with her. And we started the treatment plan here, and she's extremely compliant. So I just want to make sure you guys hear that, is that she did outstanding with actually doing what I asked her to do, okay? And that's obviously, the best patient to have. Somebody that's like, hey, I'm all in, I got nothing to lose, let's go get after it. So she did that. She did really, really well with compliance. Here's the deal. We knew we were doing the right things for her, okay? I just knew. I could see the data. I know our plan was right. Almost no improvement in almost 5 months for this patient, okay? So again, wow, right? You'd think there'd be some small breakthrough, almost none, okay? Almost none. But yet, again, I looked at the studies as I brought her back in about once a month or so, sometimes every other couple weeks, depends on what we were doing. And I looked at the studies and I just, I did tweak some things, but I'm like, you know what, we're going the right direction. I'm very confident with what we're doing. It's going to work. And it was heartbreaking, guys, I'll be honest with you. It's even, sometimes I already even talk about, she broke down at a lot of her appointments early on and was just like, I can't take this anymore. By the way, she was having people drive her to her appointments. That's how sick she was, okay? Barely could even operate a car. Think about how ill you would have to be. Had to take a leave from work. Again, we already sold a lot of her possessions and this great house that they lived in for various reasons. So it's like, she just, what left is there, right? She just losing hope by the week, by the month. So anyway, I encouraged her to stick with the program, but I did so not in a, hey, I got you. It was like I really had to help her see that this is a long-term thing we have to, approach. We have to think down the road, and we have multiple layers that we have to work through and sift through. And I was showing her that. I showed her the studies and what we're doing. And so I think it just gave her that much hope, right? Just a little bit each time we met. And about 5 months in, she reported she had full body, by the way, neuralgia, full body, like searing pain, entire right side of the body, head to toe for years, for a long time. And then brain fog, of course, and GI issues, all kinds of stuff. But this searing right side pain, so we rated it as a 10, because relative to her, when she started care, that's a 10, right? And then it had been down to a 4, okay, at about 5 months in. And for her, that's just massive. That's just a huge breakthrough. That's just, life-changing, right? But guess what? We hadn't really changed anything. Again, our approach was the same, some tweaks right from day one. And just because, again, we know we're doing the right stuff for the patient. We have enough data. We've done this for many years. We understand where they should be. And so, again, we were confident in it. And all we had to do is make sure she was still on board and continuing to be adherent to the program. And sure enough, huge breakthrough. And then recently she reported that her symptoms go down to 0. It might have a little flare up here and there, but going down to 0. So I just want to share with you guys how you just can't give up. Here's the key though. You've got to find a provider that has this holistic approach though. You got to have holistic, especially with chronic illness. It's very complex. It's not just about identifying one pathogen or one toxin like metals. You have to look at the whole picture. And you could have a small amount of toxin, but for certain patients, that could be extremely devastating to their body, even though it's a small amount, right? We have to look at all that. So that's the take-home message, is the number one, you got to keep hope, but how do you keep hope? You got to find a provider, again, that's looking holistically at the whole picture, does really good workups, and is open to working with other providers and looking at your other labs that you got, and really being forward-thinking and comprehensive in the approach. And that's how you keep hope. Then you partner with that person, when you feel in your gut you can trust them, and that's just how you get there, okay? So there's so many parts to her case. I can't go into each one, but the idea here in this video was to help you understand that good holistic medicine, is unbelievably powerful when you find the right provider for what's going on with you. All right, so keep that in mind. I'll be praying for you. God bless you, and take care. Talk soon. Okay, bye-bye.